Humanism in medicine is not far from us. It's close to us. A connection between people by a healthcare provider who came into this profession yearning to do good and to help people will find it easy to know what behaviors are good and project humanism and connection and relationship and trust, and what aren't. So I think the key advice I would say is keep that close to you, that it's doable. And it doesn't take a lot of time, because one of the studies that we helped to fund a long, long time ago indicated that when doctors know how to communicate and take some interventions that help you communicate better, that your patients perceive you as spending more time with them. So that in a study with doctors who had communication training and those who had not, that this study, and it was with the University of Michigan and Columbia, indicated that the patients thought that the doctors who had communications training spent more time with them, when indeed it was the other way around. So that's number one. Number two, people will tell you how to practice medicine, and to some degree they have control when they own your practice, or when you're a nurse on the floor, or you're a young physician. And it's going to be difficult. That's the hard one. In the face of the kinds of push to see patients quickly, to well, you'll know them better than I. What barriers are placed between you and your patient? Sometimes the electronic record, if it's not used correctly, are a barrier to your patient. You'll figure that out yourself if you are a nurse or a doctor or a social worker or anyone on the team. You'll be told, and you'll remember, that the doctors who you admire always came into the room and sat down on the same level with their patients and spoke to them. My husband Arnold used to say, and teach, I heard this just recently after he died, by fellows and residents and medical students that he trained. He used to say, if you have bad news to give a parent, that you're to sit and you give some news that is not bad, and then you give some news that is with problems and heartache, and then you give something to do about it. Have a plan. I could give you 10 examples that came in letters after he died about how he did this. And they told me that Dr. Gold always told us that when you give bad news to a parent, and that could be for any family member, that you always sit there and answer the questions until you look in the eyes of the parents and you see they have no more questions, then you can leave. You don't leave before that. Now, in today's pressure cooker world of, every 9 minutes another patient, you cannot provide the humanistic connections that are necessary. And if the hospitals and the clinics understand that you will get better outcomes if you allow humanism and relationship building, that you will save money in the end, and if you look at the data and you want to have it, we can give it to you where you can look it up, that eventually it will come regression to the mean about how time that you spend will be well spent with your patients, that they will adhere to treatment plans better. That's going to save money for medical care, that there will be fewer frivolous lawsuits. I could give you a whole list of good outcomes that will come only if you have humanistic practice.